Today we will discuss acute bronchitis, but really quickly, are you fed up with lectures using complex vocabulary to appear smarter? Whether you're a current student or healthcare provider, doctor, nurse, or pharmacist, seeking to remain up to date, this channel will provide a simple way of teaching emergency medicine in layman's terms. Here on Emergency Medicine on Demand, my goal is to help you retain tons of information in the shortest amount of time possible. Acute bronchitis is an inflammation of the bronchial tubes, which are the airways that lead to your lungs. In simple terms, it usually happens after a cold or respiratory infection and can make you cough a lot. Here's how to know if you have it. Symptoms of acute bronchitis: cough, a persistent cough that may produce mucus, wheezing, a whistling sound when you breathe, chest discomfort, a feeling of tightness or pain in your chest, fatigue, feeling unusually tired, sore throat, often accompanies the cough. Mild fever, sometimes you may have a low-grade fever. When to see a doctor: if your cough lasts more than 3 weeks, if you have difficulty breathing, if you cough up blood or yellow-green mucus, if you experience high fever or severe chest pain. Basically, when you have a normal cold, it usually lasts a week and your symptoms are improving throughout that week. However, in this case, your symptoms are getting worse and it's lasting more than 3 weeks. Acute bronchitis is usually mild and can often be treated at home. But if symptoms are severe or persistent, it's best to consult a healthcare professional. If someone has acute bronchitis, here are some simple steps to help them feel better. Rest. Get plenty of rest to help the body heal. Stay hydrated. Drink lots of water, herbal teas, or clear soups to keep the throat moist and thin mucus. Use a humidifier. Add moisture to the air to help ease coughing and breathing. Avoid irritants. Stay away from smoke, strong smells, and dust that can make symptoms worse. Over-the-counter meds. Use cough syrups or pain relievers like ibuprofen or Tylenol, which is also known as acetaminophen, for relief. Warm compress. Apply a warm cloth to the chest to help reduce discomfort. See a doctor. If symptoms don't improve or get worse, it's important to consult a healthcare provider. These steps can help manage symptoms and promote recovery. In the hospital, if someone with acute bronchitis needs help, doctors might do the following. They will check symptoms, they will ask about symptoms and listen to the lungs with a stethoscope. Oxygen therapy. If breathing is difficult, they may give oxygen to help the person breathe better. Meds. They may provide bronchodilators. They help open up the airways, and also these are used for people who have asthma. Steroids, also used for people who have asthma, and these are used in this case to reduce inflammation in the lungs. Antibiotics, if this is a bacterial infection, though bronchitis is often viral, meaning you really do not need to receive treatment for it or see a doctor, because while it does suck that you have these symptoms for a while, they will eventually go away on their own, and you can take medications to feel better, such as Tylenol or ibuprofen or cough medicine. However, these are not actually treating it or anything. The acute bronchitis will continue to run its course. However, if it is bacterial, we do need antibiotics. Fluids. They may give IV fluids to keep the person hydrated. Monitoring. The medical team will closely monitor breathing and heart rate to ensure stability. The steps help manage symptoms and support recovery in the hospital setting. Here are the common medications used for acute bronchitis. Bronchodilators such as albuterol, brand name Proventil, or Ventolin. These help open the airways for easier breathing. Cough suppressants: dextromethorphan, brand name Robitussin or Delsym. This reduces coughing. So this basically will stop that urge to cough. Expectorants, such as guaifenesin, brand name Mucinex, this will help thin the mucus, making it easier to cough up. Steroids, if inflammation is significant, such as prednisone, this will reduce inflammation in the airways. Antibiotics, if a bacterial infection is suspected. Amoxicillin is commonly prescribed if bacteria are involved. Always consult a healthcare professional before taking any medications. Also, if the person has a penicillin allergy, they will prescribe something else other than amoxicillin. Some people are more likely to get acute bronchitis. Here are those at higher risk. Smokers, because smoking damages the lungs and airways. People with allergies. Allergies can lead to respiratory issues. Young children, because their immune system is still developing. Older adults, they may have a weaker immune system. People with asthma or COPD, these conditions make the lungs more sensitive. Those in crowded places, being around many people, can increase exposure to germs. People with frequent respiratory infections, a history of cold or flu, can raise the risk. These factors make it easier to develop bronchitis after catching a virus or being exposed to irritants. Now you need to watch my video on asbestosis or have a look at tracheal stenosis.